this is Vic, and in this video I'm going to talk about the advantages of the Cyberknife and how it treats prostate cancer. It cured my prostate cancer in 2007. Right now, as I sit here today, it is April 1st, 2021. And since then, since 2007, I've heard of 4 or 5 other men that have gone through prostate removal surgery. One of them told me about the erectile dysfunction side effect that he had as a result of going through surgery. And he was literally mad because his doctor didn't even mention the Cyberknife to him. Because I told him what I went through and told him what my effects were, and I didn't go through any of that at all. He started telling me about the Viagra he was taking, how many months he had to take it for. I said, oh man, spare me the details. I don't want to hear about it. But anyway, the goal of this video, my motivation for making this video is to try to help men avoid unnecessary pain and suffering by going through prostate removal surgery. And I'll repeat myself. In 2007, my prostate cancer was cured at that time. And as a result of me learning well, first of all, my PSA was high, was very, very high. And my doctor recommended I get it checked out immediately. And I did so. He referred me to another doctor who wanted to do surgery on me. And I jumped on the internet and I did some research. And once again, this was in 2007. I did some research on the net. And the doctor who wanted to do surgery on me could not answer my questions about the Cyberknife because I kept running into the Cyberknife on the internet. And he apparently had, based on what he said, I could tell he did some light reading on it, but he couldn't answer my questions in great enough detail to where I felt comfortable allowing him to cut on me. And in this video, you're going to hear other doctors talk about the Cyberknife, how it compares to other forms of cancer treatment for the prostate. And you're also going to hear another Cyberknife, another patient that has been treated by the Cyberknife. And at the end, I will show you the video of how to find a Cyberknife treatment wherever you are in the country. If you follow my demonstrations, you'll learn how to find a Cyberknife treatment center anywhere in the country.
They don't feel anything during the treatment. There's no discomfort. Some of our patients just listen to music on a headset while they're being treated.
It's a tool that fits into the armamentarium of how we already treat patients.
As a surgeon, I want to ensure that we are really delivering our patients surgical-like precision and making sure that we're trying to minimize their side effects and yet still delivering them an effective cancer procedure. One of the advantages of the Cyberknife technology is its ability to really track even sub-millimeter movements.
That technology doesn't exist with other modalities of radiation.
So instead of putting a 20 millimeter margin around the prostate, we typically put about a 3 millimeter margin around the prostate. So we're radiating less of the bladder, less of the rectum, and we're able to give the radiation much faster in 5 days as opposed to 9 weeks.
After the treatments are over, patients can go back to any activities they want, whether they go back to work, go on a vacation, and that's one of the real attractions of the patient is I've had patients having to go to Europe the following week, and they're able to do that after the Cyberknife treatment.
And the nice thing about the Cyberknife, in contrast to our conventional radiation, is that since we're giving the radiation so much faster, by the time the side effects have kind of come and gone for our regular radiation treatments, they would just be starting for the other forms of radiation.
We now have data emerging from research studies that's showing that the side effects from Cyberknife for prostate cancer are less than those seen with external beam, with seed implants, and with proton beam radiotherapy, while the biologic dose that we're delivering is as good or better than any of these.
A lot of our patients are candidates for surgery, and they choose to have Cyberknife because they don't want to go to the operating room if they have another alternative that is as good or better even.
The most commonly recommended treatment for addressing early-stage prostate cancer is the radical prostatectomy. And while it's an effective treatment, there are some potential long-term side effects from it. Some patients end up with incontinence. Probably over half of patients end up with erectile dysfunction. It's a major surgery. Even if one performs a robotic prostatectomy, the incisions are smaller, but still the surgeon has to cut out the prostate.
So there are the patients that can't have surgery. There are patients that have already been radiated once and we can retreat them. And then there are patients who just don't want to have more aggressive therapy, particularly our older patients. So it's not unusual at all for me to treat a person in their 80s or 90s. Not unusual. That's an everyday thing for us.
But I think it's important, and it's our job as physicians to make sure that our patients have all the options available to them, especially if there may be an advantage to them. And we believe that with this technology, there may be a real advantage, particularly in the short course in which they can be treated for their prostate cancer.
We're thinking about treating cancer in totally different new ways, and it's no longer one size fits all. Everything is individualized and tailored to the individual in which you offer them and how you go about offering them the treatment, and it's really an exciting time to be practicing radiation oncology.
Just feelings that are unmatched. Life did come to a stop. You never expect to hear those words in your life. As much as you can prepare for it, you never expect that it's going to be you.
About 1 out of 7 men will be diagnosed with prostate cancer. We have an excellent way to screen for prostate cancer. It's called the PSA blood test, the prostate-specific antigen. We can usually detect prostate cancer when it's still curable.
The VA won't check your PSA unless you, as a patient, ask for it. So I did get a PSA check. Before they recommend a biopsy. When I found out what my current number was last October, it was 14.6. It's that moment, those lovely 3 words, you've got cancer.
So you can come in here, sir, and just have a seat here and lie back with your head up here.
I took it as almost another mission. Your body is eating itself up. What weapons can you employ to actually take on this enemy that's now inside your body?
We'll start aligning you up to our target there. You'll feel the table move a little bit.
The most effective weapon was the Cyberknife.
The Cyberknife is the most advanced radiation device for precisely delivering radiation to a specific target in the body. It uses robotic technology to identify where the prostate is, and if there's any motion, it adjusts for it and treats with under 1 millimeter of accuracy. We do it in just 5 doses over 1 week, and because of that, it's much cheaper than conventional radiation therapy.
You don't even take your clothes off. You lay down on the table, listen to jazz music, walk out and carry on as though nothing had taken place. There's no scars, there's no chemotherapy issues of losing your hair. This is all natural hair loss. So I'm about 7 months out from my treatment. At 6 months, my PSA was at 2.2. I'm ecstatic about the whole thing.
We're just trying to get a quick photo here before a horse shows up.
I stay in touch with those guys today, and we all still get together and we share stories.
There's all the boys.
Guys get this ego and they want to ignore it all. It's okay, it'll get better. Get them to go do their test. You are not invincible when you're given a diagnosis of cancer.
This portion of the video, we will look at how to find a Cyberknife facility anywhere in the continental United States. Right now, I am at the website cyberknife.com. And now, to find a treatment center, wherever you are, just go to the bottom of this home screen, click on Find a Treatment Center. I'm going to have to scroll down a little bit. Okay, and by default, several continents will show up. And each icon on the screen represents a Cyberknife facility. And there's facilities in Asia, there's South America, and we're interested in the United States. So I'm going to select filter by country. I'm going to scroll down and look for the United States. I'll select the United States option. And now you notice on the screen concentrates on the United States, on North America. And on the left-hand side, I'll enter an address where it says enter address or postcode. I will type in a city. I typed in New Haven, and there's multiple New Havens. There's New Haven, Connecticut. There's New Haven, looks like Indiana, Michigan, Missouri, Kentucky, and the first one, the one I'm looking for is New Haven, Connecticut. So I will select that one. And by default, if you see my cursor, it's looking for a Cyberknife within 200 miles, no further than 200 miles away from New Haven, Connecticut. And we see there's one in Hartford. There's one in Providence, Rhode Island. Looks like a couple in Boston, Worcester, Massachusetts. And there's Long Island and several in New York. And Philadelphia as well. And I'll click on the one in Hartford for demonstration purposes. St. Francis Hospital and Medical Center. There's the information about the facility. Cyberknife, United States. 94 Woodland Street, Hartford, Connecticut. Zip code. There's a link to the facility website and directions. Now, when I click on directions, it's going to show me how to get from my location to that facility. When you click on directions, it's going to show how to get from your location to that facility. I assume that the web server knows our approximate location based on our IP address. And I will close that tab out. And I'll go ahead and search for another. I'm going to go over to the West Coast now. In Los Angeles, California, that's exactly what I'm looking for. I'll select it. And there's Cyberknife facilities in and around Los Angeles. There's 1, 2, 3, 4. Close to Los Angeles, there's Irvine, California, and there's one that looks like Los Angeles, I think. Let's see. It's in Pasadena. 630 Raymond Avenue, Suite 104, Pasadena. And there's a facility website, and again, directions. And once you click on facility website, it's going to, each website is going to be very, very different. It's beyond the scope of this procedure, of this presentation, to show you how to navigate the different websites. Each website is going to have a graphic of the Cyberknife, but the navigation and menuing system is going to be potentially very, very different. So I'll close that tab out. And directions, I'll click on directions again just for demonstration purposes again. And it shows me how to get from my location to that Cyberknife facility, the one that I selected. And once again, it's going to show you how to get from your location to whatever facility you select as well. I'll close that tab out. And I'm going to go ahead and select my city. My city and state. I'll X off Los Angeles. In Charlotte, North Carolina, that's exactly what I'm looking for. And there's, again, a default for some reason is within 200 miles, no further than 200 miles away. Okay, there I am, Charlotte. There's one, it looks like Asheville. No, it's in Greer, South Carolina. And again, facility website, directions, and there's a phone number there as well. And by the way, if you're researching for yourself or for someone else, the phone number once again is there, and you can call there and tell them what what information you're looking for, and why you would like to speak to someone. Every facility I've ever contacted, everyone is always very friendly and professional, so we shouldn't have any problems in that area. And that's the extent of this video. If you're researching for yourself or for someone else, I wish you luck in your research. It's surprising to me that the Cyberknife is not more widely known in the medical community. Like family physicians, they're very busy taking care of their patients, and that's understandable. They're not up on doing a lot of top-notch, up-to-the-minute research. They're busy taking care of their patients and providing good service. And there's nothing wrong with that. Once again, I'll repeat myself. My cancer was cured in 2007. Right now, as I sit here, it is September 2021. My cancer was cured in 2007 because I jumped on the internet and found an alternative to surgery. The doctor that wanted to do the surgery on me seemed to have did some reading about the Cyberknife. I could tell based on the way he answered my questions. But he didn't answer my questions in good enough detail to satisfy me, to where I wanted to let him cut me open. And I called the Cyberknife facility. At the time, there was one just 20 miles away from me. They no longer use the Cyberknife itself, but they do use another brand of linear accelerator. But they no longer use the Cyberknife. But at the time, they had a Cyberknife 20 miles away from me. So I called the Cyberknife facility, worked out some insurance issues, and made an appointment with the doctor. The doctor did additional tests on me and determined that I was a good candidate for treatment with the Cyberknife if I wanted to be treated without being cut open, without surgery. And I said yes, that's what I would like to do. And he made the appropriate arrangements. And every day for 5 days in a row, I stopped and laid down for 45 minutes for 5 days in a row. And they said, okay, we're done. You can go. We're finished for the day. And after the 5th day, that was it. It was absolutely painless, and it was I was kind of paranoid as a result of not feeling any side effects, because I told my wife I didn't think it was having any difference on me. I didn't think it was doing its job, but it turned out it did its job very, very well without interrupting my life. But anyway, I'm getting beyond the intended scope of this presentation. That's how you find a Cyberknife facility. You can just type in the name of the city like I did, or you can type in the zip code. And I typed in 06519, and once again, there's New Haven, Connecticut. I happen to know the zip code for New Haven. So you can go by the name of the city, or you can type in your zip code. And that's it for this presentation. And good luck to you and whoever you're researching this information for. I wish you well. Thank you for watching.